Hello, everyone. Greetings of the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know that taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. G. Vidya Reddy from Warangal to enlighten us on the topic of fungal infection. Dr. G. Vidya Reddy is a diploma in venereology, dermatology DVD. She has 20 years of experience in this field and she is the founder of Hruday Skin Clinic, which is located in the center of the town and is equipped with all sort of laser facilities. Over to you, doctor. We would like to welcome you to today's platform. And with that, let's move on to the first question. Let's know in your language what is fungal infection.
Yeah, really good evening and thank you for welcoming me to this show. Nowadays, people are mostly suffering with the fungal infection, that too in the college students, and due to this humid weather and due to wearing of um, clothes which are very wet, people are more prone to fungal infections. So there are certain precautions by which we can avoid these fungal infections. It can be due to some of the genetic reasons or due to improper health or some diseases like diabetes, which some people are more prone to fungal infections. But general health instructions will decrease the fungal infections, like taking care of having a bath twice daily and keeping your inners and everything dry and using a powder or a dusting powder in the inner parts will decrease the sweat while you are working. And don't use over the counter medicines like steroids, which will temporarily decrease the infection, but they will flare up the infection, and then you will be more prone to fungal resistant fungal resistance. So the treatment will be difficult. So before getting the fungal infections, if you take the precautions and once you get the infection, just visit your nearest dermatologist so that it will help you.
Right. Doctor, if we are talking about fungal infection particularly today,
Yeah.
but when we talk about any sort of disease or any sort of condition, identifying the disease or condition becomes a challenge for us. So, how
Yeah.
does the initial stage of the fungal infection look like? What are the early symptoms of it?
Yeah, some people generally, some people even psoriasis or eczema, they can be confused with the fungal infections. But if at all you are having itchy or in the inner parts or in closed humid areas, then you have to think it as a fungal infection. Don't use any other over the counter except for the powder. Then if you are not, it is not decreasing, then better you consult a dermatologist.
Right, right. So is it like a round rash, like
Yeah,
lesion
it
on
looks
the skin?
like a round coin lesion with the central
Hmm.
healing and the periphery papules will be there, so which will be slowly increasing.
Right. Right. So, doctor, fungal infection can appear at any part in our body. So, does all the fungal infection in different parts can have different causes behind it?
Yeah, means it depends on the like the family will be different, but the whole thing is a fungal infection. It can be
Hmm.
fungal infection of the nail, it can be fungal
Hmm.
infection of the hands, it can be fungal
Hmm.
infection of the inner thighs, or fungal infection of the skin, or fungal infection of the face. Even there is one condition called tinea incognita, which is due to steroid resistant fungal infection, which occurs mostly on the face due to overuse of fair and lovely or any other creams which
Right.
temporarily decrease that fungus, but the fungus will be growing.
Hmm. Hmm. Right. Right.
So the cause will
You
be
said
same,
fungal.
but the
Right.
family will be different,
Right.
like the fungus.
So, doctor, you mentioned fungal infection on the nails. So, we normally get to see the women who are continuously working in the houses, always in contact of water. They usually have a thick nail or some lining, overlining on the nail, or darkening of the nail. We see such conditions on the nail. So are these images of a are of a fungal infection?
No, actually, the normal healthy nail doesn't be affected by the fungus. Only the nail which has traumatic, or the people, as you told, some people they just immerse their hands like housewives while doing the
Mm,
household work, in even washing. The cuticle which covers the nail, it will be damaged. So the water will be continuously soaking into the nail, and they will be more prone to the fungal infections.
right, right.
So we
So
have to,
how
okay.
right. Right. So, doctor, how long does it normally take for such patients who are suffering from fungal infection on the nails to be cured? Because it becomes a very tough task to get it cured when the infection occurs in the nails.
See, the treatment for the fungal infection of the fingernails is different from the
Hmm.
toenails. Toenails take
Right,
much longer time, like 8 months
right.
also. Even the fingernails, they take almost 6 to 8 weeks. But nowadays, there is long pulse laser also, which helps
Hmm.
to decrease the fungus in addition to the oral medication.
Right. Because we are talking about treatments, doctor, what are the usual treatments, the first line treatments which we normally suggest our patients?
See, we suggest the antifungal tablets. Other than that, we give them a nail paint so that the water doesn't go into the nail bed, and also it protects from the fungus.
Hmm.
In that way,
What
when
about
we are
the
used, yeah,
right? What about the rest of the fungus, doctor? The fungus which appears in the scalp, or say
yeah.
fungus in the groin area, as you mentioned.
See, fungus in the groin, it will be more increased in certain humid conditions, and also the people who sit longer time over their office. So in that conditions, if they use the precautions, it can be decreased. But with proper medication, even it will be decreased within. We can see the result within 20 days also. But after that, they will again be prone to the fungal infections because their working condition is that, so they have to take care of the proper precautions.
Right. What about scalp? How does the fungus in scalp looks like?
See, coming to the fungus of the scalp, it depends on the age of occurrence. In younger children, the fungus of the scalp will be more, and it varies from the just scaling of the scalp to infection of the scalp. So, and also in the adults, you can see the seborrheic dermatitis and the normal fungal infection, which people normally call it as dandruff. The treatment varies from the age group and the person to person.
Right, right. So, does hygiene plays a very important role in fungal infection?
Definitely, hygiene plays a role, and also the working conditions. When the clean scalp is there, and in addition, you have to take the proper medication so that the fungus will not recur again, which
Right.
hinders the growth of the fungus.
Right, right. Doctor, we all know that when anybody from the family is suffering from fungal infection, everybody has to be a little cautious. So, we are saying that fungal infection is contagious.
Means the sharing of towels and the same working
Hmm,
conditions, it all depends on that. They act as a fomites which carry the fungus. That's all. Other than that, you have to maintain your own personal hygiene.
right, right. Specifically, doctor, if we speak about fungal infection in the groin area, can it occur from using public toilets on a daily basis?
It I don't tell that 100% it comes with the public toilets. It depends on the person's genetic condition, and also the way he is wearing his clothes, and also the humidity, and also you have to keep your private parts in a dry way so that the fungus doesn't grow. The basic growth of the fungus occurs more in the humid condition. So wherever
Right,
the any condition where it is dry, no, the fungus will not grow. And in groins, it is more like of wet area. So the people, they are more prone to fungal infections in that area.
Right. Also, doctor, can not drying our clothes in the sun also be a reason? Because now it's monsoon. A lot of places are facing rainfall or waterlogging. It's very hard to dry our clothes. Normally, we see that people are drying their clothes inside their houses only. So,
Yeah.
uh, does sun drying has some benefits in fungal infection as well?
I sun dry, it has benefits, but in addition to the sun dry, because this is the monsoon season and you can't
Mm-hmm.
say, but the wet cloths, they play a major role in the growth of the fungus. They help in the growth of the fungus.
Right, right, right. Moving ahead, doctor, let's move on to the next question. Amongst all these fungal infection, which is the most serious fungal infection of all?
See, the groin fungal infection or the body fungal infection, everything, it can be, the time limit will be there. Like in certain days, it can be gone. But the fungal infection of the nails, it takes a longer time. And the fungal infection which occurs in the younger children, they are more prone to for the damage.
Right, right. What if the person is not getting himself or herself treated and prolonging the condition? What can be the worst case scenario?
See, we can see, I have seen certain patients also, they will have the fungal infection more than 60% of the body. Then these medications also, topical medications and the oral, they generally don't work.
Right,
Sometimes it can be confusing even with the psoriasis. So it will take a
mm,
little longer time for them.
right, right. Moving ahead, doctor, antifungals, you mentioned that earlier. We normally suggest our patients for antifungals if they're suffering from fungal infections. Can consuming these antifungals for a longer period of time somehow be harmful for the patients? I mean to say, are there any side effects of it?
See, there will be only certain time limit for the fungal infections treatment only.
Mm-hmm.
But sometimes people, they have gastritis. So better to
Right.
use an antacids along with them. The doctor will prescribe the antacids along with their fungal infections.
Right. Speaking of that, doctor, you mentioned that there has to be a time limit behind it. So normally the time limit is can only be known by a dermatologist or by an expert. Uh, we see a lot of patients, they go for self-medication nowadays.
Yeah.
So either they will ask their neighbors which medicines are you using, or their near and dear ones, or they will uh, go to the chemist and they'll ask the chemist to give a medicine for the kind of fungal infection they are having. And we normally see that the pharmacies, they do offer such kind of medicines to the patients for fungal infections, very frequently adapted by the society now. So how harmful can this be for the patients?
Yeah, this is a major problem with the fungal infection. Otherwise, it would never have been a topic of debate today. Because the
Right.
fungal infection, the scenario has changed with the chemist. Because they are prescribing the steroids for the fungal infections, the scenario of the fungal infection has changed. And what do you call is tinea incognita? Because that is, it is becoming resistant to treatment. So,
Hmm.
in addition to just consulting your dermatologist, you have to even maintain your personal hygiene and your health, and taking a proper diet. These all things play a role. So just whenever you are having any small rash, you can just um, treat it with a simple medication by a dermatologist rather than going to the chemist and using a steroids and then making it more complicated even for the dermatologist. So
Right.
better not to use any over the counter medication. That's the advice I just give to the patients. Maintain your proper hygiene. If at all you are having really any itching or in the monsoon weather, maintain a dry clothes and also use a good dusting powder which keeps the parts dry, so that you just don't sit too long. If at all your working conditions uh, means they you want to you have a lot of hours for the working condition and sitting position, then you have to use a proper powder or antifungal powder. These all the things they prevent the growth of the fungus and conserve
Right.
your doctors.
Right. Doctor, diet also you mentioned that plays a very important role when we're talking about fungal infection. Tell us initially that can having a low immunity somehow trigger the condition?
Yeah, certain diseases like diabetes, people they are more prone to fungal infections. If at all you
Hmm.
were, even though if you're diabetic, but your sugar levels are maintained in a normal way, then that fungal infection will be cured. And naturally, maintaining a good health, it improves your health and also decreases the infections.
Right. What about diet? What are the do's and don'ts if somebody has to follow if they're already suffering from the condition?
See, this in particular, it's not there, but overall, the things which help to increase your health, like decreasing the non vegetarian food and the spicy food, which causes a lot of sweat, and also eating more of vegetarians and green leafy vegetables will add to your health.
Right. Doctor, uh, stress plays a very important role when we are talking about disease nowadays. We know that stress triggers almost all the conditions in our body or all the diseases in our body. So, has stress any direct relation with fungal infection as well? Can it also trigger the condition?
See, I will just tell you one simple thing about the fungal infection is just humidity or any water. Fungus grows more in the humid conditions. Stress actually it increases the humidity, or the people who stress a lot they will have more sweat and they will be more prone to fungal infection.
Right.
In that way it
Basically,
plays a
we are saying that to maintain the personal hygiene, to stay away from sweat, even if we are having sweat, as you have already mentioned that the powders, the antifungal powders which we get in the market, we can use that. um, these are the conditions, the wet conditions where normally fungus grows, we have to normally avoid these. But are there any specific food or any specific diet which can help them improve their immunity?
see taking a healthy diet and eating more of green leafy vegetables and fruits will increase your health. See that your diet is in a balanced way.
Also,
Avoiding,
doctor, tell us. Yes, please, please, please go
yeah,
on.
avoiding all the junk food for the teenagers. That's the
Mm,
thing.
right. Doctor, obesity is another issue which people are suffering from nowadays. Can obese patients normally suffer from fungal infection? Are there more chances, I mean to say?
These obese patients generally they will have some type of they will have more of a sweating problem. They will not do means the physical activity will be decreased in those patients. That will be the one of the
Mm,
reason for the obesity. So they will be more prone to fungal infections than the normal counterparts who are lean.
right. But because we are talking about fitness here, nowadays people are very much used to going visiting the gyms. So, what if somebody is already suffering from fungal infection and the person is visiting the gym, and as we know, all the equipments are used almost by everyone. So, can fungal infection also be spread through sweat? Is it possible?
No, not sweat. See, it is present through the fomites, but still we have to maintain our own hygiene. Then it will be decreased. Once you come out of the gym, see that you bath properly and use your own towels instead of the sharing with the other ones.
Right, right. So basically, in today's life, we have focused on some very strong points, which are maintaining your personal hygiene, eating good food, staying healthy, and keeping not keeping your body moist. So these are few things which we are mentioning again, again, again. Yes, self medication is something which we always ask our viewers not to go for. Whenever you see any condition, any changes in your body, all you have to do is visit your nearest expert. Well, we had a wonderful discussion with you, doctor, today. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, nowadays the teenagers, hello,
Yes, doctor, we can hear you.
just maintain a good diet and good health. It will decrease all the problems, not only the fungal
Right,
infections, but the common problems which the youth are facing, like obesity and also hair fall, everything. The lead cause will be you're not taking the proper diet which you maintain.
right, right. Very well said. As we always say कि आप जैसा खाते हैं आप वैसा दिखते हैं. So to look beautiful, you have to eat well and of course maintain a healthy diet, maintain a healthy routine. Thank you so much, Dr. G. Vidya Reddy. We had a wonderful discussion, a very informative discussion on the topic today. And we thank you so much for your valuable time. It has been a very, very wonderful session, and we look forward to much more sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.